is Dr. Ezi, and this is the 9th session of Polytrauma Station. Okay. You see, you may feel that this station is too long, but actually this is one of the shortest stations in the exam. So this is a Polytrauma Station. We are still discussing the pathology stations. So we spoke lastly about the hypersensitivity reactions, and now we are going to answer the questions of the examiner, who will jump to another topic. And as he is jumping to another topic, actually he is returning back to the scenario, because from time to time he will return back to the scenario. As you remember, this patient had a polytrauma, he had a splenic rupture, and this patient had a huge bleeding. So the next 6 questions in this station, and that is so good actually because they are so easy, the next six questions will be around this topic, okay, around this point of the management of the patient's hemorrhage. So let us start here. The first question in this part will be, which blood products will you give? What will you give this patient? And here you will give packed RBCs, right? This is easy. There is no problem with that, okay? So the second question he will ask you, if you give this patient packed RBCs, what is the percentage or how much white blood cells are in a bag of packed RBCs? This is a difficult question. It is not difficult, but you want to know the information here, okay? You want to know first is that the packed RBCs are usually leuko-reduced. So the WBCs are reduced, or white blood cells are reduced in a pack of packed RBCs. And the reason for that is to reduce the reactions, immune reactions, okay? So after this reduction of WBCs, how much white blood cells will be there in the packed RBCs? And the number will be like this. They will be less than 5 multiplied by 10 up to 6 cells per liter. Some people mention the number only. The answer is wrong. You have to mention that they are less than 5 multiplied by 10 up to 6 cells per liter, okay? These are the WBCs in a packed RBCs bag, okay? Let us go to question number 3 here. And this is a very easy question. They will ask you, how long is the lifespan of RBCs? And as you know all, it is 120 days, 120 days, okay? So that is good now. Let us go to question number 4. Question number 4 here, they will ask you what are the tests that you are going to do before starting blood transfusion. And the tests that you are going to do here are, as you know, everybody knows that, they are ABO and RH. Okay, these are the tests that you are going to do, ABO and RH. This is the answer, period. Question number 5. Okay, they will ask you the longest question here, or the question that will need the longest answer. What is group cross matching? Okay, this is the definition that they will ask you to answer here. And the definition that you want to tell the examiner is that it's a test. Okay, first of all, it's a test, okay? And this test tests the donor's RBCs. You have to remember this and don't get confusion. Donor's RBCs, the blood that will be given in the packed RBCs, we will test it against the recipient's serum. Why? Because in the serum of the recipient there will be the antibodies against the antigens on the donor's RBCs. Okay, so you test the donor's RBCs against the recipient's serum, which contains antibodies, and if there is any problem or there are any antibodies against the antigens of the RBCs of the donor's blood, there will be hemolysis. Okay, you do not want that hemolysis to occur inside the body of the recipient, so you do this test. Okay, and this is simply the definition. It is testing the donor's RBCs against the serum, which contains antibodies, if any, okay, to detect any potential incompatibility. Fine, and this incompatibility would lead to the hemolysis of the donor cells. Okay, so this is question number 5. The question number 6 is the last question here, and it is also easy. What are the antigens in cross-matching? And we mentioned that before. They are the A, B, O antigens. Okay, so that's all about this part of the station.